Ever found yourself submerged in sadness after a particularly stressful event? Perhaps a job loss, a breakup, or even the passing of a loved one. You might have been experiencing what mental health professionals call situational depression. This is a short-term, stress-related type of depression that can occur in the aftermath of various traumatic changes in your normal life. Now imagine this scenario. It's a typical day in your life. Everything seems normal, but deep down you're not feeling quite right. You're not sure what it is, but you can't seem to shake off this persistent gloom. Could it be situational depression? To help you make sense of your feelings, here are 6 common signs of situational depression. First, there's persistent sadness. You feel down most of the time and can't seem to find joy in activities you once loved. Second, you may experience a significant change in appetite. This could either be eating too much or too little. Third, there's difficulty sleeping. You might find yourself waking up frequently during the night, or you might be sleeping more than usual. Fourth, you may notice an increase in irritability. Little things that didn't bother you before now seem to get on your nerves. Fifth, there's a feeling of hopelessness. You might feel like nothing will ever get better or that there's no point in trying to change things. Lastly, there's a decrease in energy. You may feel tired all the time, even when you've had enough sleep. These signs can be subtle, but they're important to recognize. Situational depression, while temporary, can have a significant impact on your life. It can affect your relationships, your work, and your overall well-being. It's crucial to remember these 6 signs: persistent sadness, changes in appetite, difficulty sleeping, increased irritability, feelings of hopelessness, and decreased energy. These symptoms are not just simple terms, they're indicators of a deeper issue that many of us face, yet shy away from discussing. Situational depression. It's a mental health condition that is often brushed under the carpet, but it's a prevalent issue that needs to be discussed openly and honestly. Persistent sadness. The first of these signs isn't merely feeling unhappy or disappointed for a few hours or even a few days. This is a prolonged, consistent feeling of sadness that lingers and affects your everyday life. It's a form of sorrow that feels relentless, never-ending, and often leaves you feeling numb or empty. The second sign, changes in appetite, can manifest in 2 ways: as a decrease in appetite, where eating feels like a chore, or an increase where food becomes a source of comfort. This isn't about having a larger-than-usual meal at a holiday dinner or skipping breakfast because you're running late. This is about consistent changes in your eating habits that are out of the ordinary for you and to your emotional state. Then there's difficulty sleeping. This is not about the occasional restless night due to stress or the odd late night spent cramming for an exam or finishing a project. It's a continuous struggle with falling asleep, staying asleep, or even oversleeping. This can leave you feeling drained, adding to the burden of your depression. Increased irritability, the 4th sign, is more than just being in a bad mood. It's a constant state of annoyance, frustration, or anger over seemingly minor or insignificant issues. It's an overwhelming sense of agitation that seems to loom over you, affecting interactions with others. Feelings of hopelessness. The penultimate sign is a deep-seated belief that things will not get better, that your situation is permanent, and that there's no point in trying to change it. This isn't a fleeting thought during a particularly bad day. It's a persistent feeling of despair that can feel impossible to shake off. The last sign, decreased energy, is a constant state of fatigue that isn't alleviated by rest or relaxation. More than just feeling tired after a long day of work, this is a continual lack of energy and motivation to engage in activities. It's a feeling of being drained, both physically and mentally, that leaves you struggling to get through the day. If you or someone you know are experiencing these symptoms, it's important to understand what they mean. They are to be ignored or brushed off. They are a call for help, a signal that something is not right. It's crucial to acknowledge these signs and take them seriously. Seeking help in such situations is not a sign of weakness, it's an act of bravery. It's about having the courage to face your fears, to confront your emotions, and to admit that you're not okay. It's about reaching out for support, about seeking professional help that could guide you through this tough time. Because with the right help, you can find ways to manage these symptoms and improve your quality of life. Reaching out to a mental health professional could be the first step towards healing. These professionals are trained to understand and navigate the complexities of mental health. They can provide you with the tools and strategies you need to manage your symptoms and work towards recovery. Remember, it's okay to ask for help. It's more than okay, it's essential. No one should have to struggle with these feelings alone. It's okay to talk about your feelings, to open up about your struggles. It's okay to admit that you're not okay, because in doing so, you're taking the first step towards overcoming your situational depression. Remember, your mental health matters, you matter, and help is always available. Before we conclude, it's crucial to underscore that self-diagnosing can be a perilous path to tread. While it's important to be aware of the signs of situational depression and to understand your feelings, it's equally essential to seek professional help for an accurate diagnosis. Medical professionals, such as psychiatrists and psychologists, have years of training and expertise in diagnosing and treating mental health conditions. They can provide a comprehensive evaluation, consider all possible causes for your symptoms, and recommend an effective treatment plan tailored to your needs. Self-diagnosis, on the other hand, carries inherent risks. Misdiagnosis can lead to inappropriate or ineffective treatment, which can further exacerbate your symptoms or lead to unnecessary distress. It can also create a false sense of certainty, potentially causing you to overlook the need for professional help. If you find yourself identifying with the signs of situational depression discussed in this video, it's crucial to reach out to a healthcare provider. Do not hold back out of fear or stigma. Remember, seeking help is a sign of strength, not weakness. Remember, it's okay to seek help. You're not alone in this. Mental health professionals are there to support and guide you through this journey. Let's ensure we treat our mental health with the same importance as our physical health. So, if you're struggling, reach out to someone who can help. Stay tuned for more informative videos on mental health, and remember, you matter.